Good evening, class. I have a question for you. What would you do if you just married your college sweetheart, you were ready to settle down and start a family? You go to the doctor, and the doctor tells you that you or your spouse are incapable of conceiving children. What do you do now? The reason I asked you this question is because I chose to research IVF, or in vitro fertilization. I chose this topic because I work with many children that were conceived by IVF, and it always has made me wonder why and how it works. I've also realized that IVF pregnancies tend to result in multiple births, and I just couldn't understand why. Today I would like to talk to you about the method, the pregnancy rate, the complications, and the cost of IVF. So let's begin. There are 7 steps to IVF. The first step is ovarian hyperstimulation. This involves taking multiple medications that stimulate the follicle of the ovary. Different human hormones are injected into the patient, and their estradiol levels are closely monitored. The injections take about 10 days and are started on the 3rd menstrual day of the patient's cycle. Spontaneous ovulation is avoided during this time using different types of medication. The second step in IVF is egg retrieval. This is when the follicles mature and human hormones can be injected to induce the ovulation of the egg within 42 hours. Eggs are removed transvaginally, and usually 10 to 30 eggs are taken at a time. The patient is usually under general anesthesia to avoid general discomfort. Step 3 of IVF is egg and sperm preparation. This involves the egg and the sperm being in the lab. The egg is removed of all surrounding cells, while the sperm is removed of any inactive cells and seminal fluid. The 4th step of IVF is fertilization. This is when the egg and the sperm are incubated together for 18 hours. If it is necessary, an egg can be directly injected with a sperm, which causes an additional 48 hours of incubation time. The 5th step of IVF is embryo culture. This is when the egg and the sperm are allowed to grow in a controlled environment for up to 5 days after retrieval. The 6th step of IVF is embryo selection. This is when the embryos are graded on a morphological scale and determine which embryos are most optimal. The embryo is then screened for any inheritable diseases to disregard any that may cause chromosomal abnormalities. The 7th and final step of IVF is embryo transfer. This is when the embryos are graded based on the number of cells, the evenness of growth, and the degree of fragmentation. The number of cells transferred into the patient depends on the availability, the age of the woman, and other diagnostic and health factors. Usually several embryos are implanted at once to ensure the rate of successful pregnancy. Now that we understand the method of IVF, let's look at the success and failure factors and some negative and positive aspects affecting IVF. Some factors that can cause failure in a pregnancy would be tobacco use, a higher BMI, and higher caffeine and/or alcohol intake. With a higher BMI, there's a 33% decreased likelihood in a live birth. However, some positive factors that may increase the chance of a successful IVF pregnancy would be being the optimal age during treatment, which is between 23 and 39 years old. There is also research that suggests acupuncture can help with the success rate of an IVF pregnancy. Research has shown that acupuncture may increase the blood flow to the uterus and ovaries. It may also help to reduce stress, anxiety, and depression. There has also been research that supports the idea that the rate for successful IVF pregnancy may be increased due to previous successful pregnancies. In the case of a successful pregnancy, I have some statistics for live birth rates. By definition, a live birth rate is the percent of the IVF cycle that results in a live birth. A Canadian study done in 2006 found that there was a 27% live birth rate for IVF pregnancies. It was also found that birth rates were about 36% higher in patients 21 years and younger. For older patients, there was a lower rate and it decreased with age, with no live births for patients 48 years or older. Another study also found that with the more attempts of IVF, there is a higher rate of success in live birth. For example, there is a 45 to 53% success rate with 3 attempts of IVF, and a 51 to 71% success rate with 6 attempts of IVF. Another aspect of IVF to take into consideration would be the cost. The average cost of IVF is $12,000 per cycle, with the lower estimate being $10,000 and the higher estimate being $15,000 per cycle. Whether the embryo is fresh or frozen also has an effect on the cost of the procedure. Additional costs need to be taken into consideration when looking into IVF. Other costs may include an egg donor, a sperm donor, the embryo donor cycle, and embryo freezing. Some extra costs may include the cost of fertility drugs, ultrasounds, monitoring procedures, and blood work. While researching IVF, I also found some possible complications. It has been found that twins and larger multiple birth orders are more common among IVF pregnancies. Multiple births are related to increased pregnancy loss, prematurity, neonatal mortality, long-term damage, and low birth weight. Other complications related to IVF include cleft lip, chromosomal abnormalities, dislocated hips, cerebral palsy, and more. However, there is some debate over whether or not there is a strong enough correlation between these complications and the IVF pregnancies. Obviously, IVF can be very dangerous and costly at times. However, it may be the only option for individuals that are having trouble conceiving or incapable of conceiving. I feel as though IVF is a possible solution to anyone having issues. However, all physical and mental factors should be taken into consideration when looking into the idea of in vitro fertilization. I enjoyed researching this topic, and I found the answer to all the questions I previously had. I hope you enjoyed listening to my speech and were able to learn some new information. Have a great night, and thanks for listening.